I think we will first start with how do you really define negotiation? And I think each one of us have different concept in our mind on what negotiation could be. Some of us perceive that it's getting whatever you want from the other person, no matter what. We would do it. This is what I want. This is what I want to get, and I will work towards it and get it anyway. Some of us feel that it's ask for as much as you can, ask for a lot, but wind up settling for whatever you can get. Somewhere in the middle is okay, and that's our perception when we start our negotiation process. And most of us would probably feel that it's kind of a trade-off between what you get and, more importantly, getting along with people, because this is all long-term relationship building. It's not just an end to the association we could have in the long run. And therefore, when we think about negotiation, I think the two elements that automatically come to our mind is a little bit of flexibility and reasonableness before we proceed any further. And the whole concept of negotiating with the administrators comes because of the fact that we think differently. And as doctors, a lot of the time we go by studies. Is there randomized studies? Is there case reports? What do we have? What is the evidence? Is it evidence-based? We want to be professional. We value professionalism, we value volunteerism, and the concept that ours is a noble profession and we shouldn't dilute it always. Money or other factors certainly plays a big role when we talk to administrators, and sometimes that doesn't go well because the way the corporate world or the administrators tries to make decision is very much oriented towards their level of data in a different way. I mean, they are talking about decision making based on whether they can reconcile what is desirable, what is reasonable, but they also want to ensure that there is leadership, appropriate governance, and more importantly, what is the strategy for the future. And their terms, pretty much similar to what we are thinking, is they are wondering, is this going to be a cost center? Is this going to be a profit center? I'm particularly thinking about critical care units. And also, is there a certain level of corporate social responsibility? And this is where we talk about, as individuals, about volunteerism and noble profession, but the business or the healthcare business concept thinks about it more as a corporate social responsibility of meeting the needs in their own way, even for tax purposes. So, like it or not, we think of healthcare as the green healthcare, but the administrators think of it as the red business part. So, we need to somewhere gel in between to make this work. And yes, all of life is money and politics, and the rest is hobby, as Arthur Coombs says in this article. But I think very few of us can consider our profession a hobby, so we have to somewhere get into the money and politics part, which is where we have to discuss with the administrators. So there's a tremendous communication gap between the clinical world that we are practicing and the way the business governs us, which is why I think there's a lot more interest amongst doctors to also learn management administration. And when I did my MBA, there were a lot of people asking me, you're a good doctor, why do you want to do an MBA? The real answer is to become a better doctor, because I think now we know how exactly to talk to the administrators and get what we want. And we have to learn their vocabulary, whether we like it or not. We have to learn budgeting, we have to learn revenue projection, we have to talk about net present value, internal rate of return, return of investment. A lot of these terms, in some way, we have to start getting familiar with to convince them. So what are the essentials when we start negotiating with the administrators? Of course, we need to be prepared. We need to know what we are talking. We need to know what we want. But we have to be objective about it, and we have to clearly tell them what are our strengths, weaknesses, and what are our goals in any kind of project that we are dealing with, but focus a lot on the positives, at least initially. And again, there's no project that's 100% win-win, but I think it's important to make sure that they hear the positives first. Start strategizing, and by strategizing I mean plan something that's a realistic course of action. A lot of the times the administrators would say, when do you want to start, and their answer would be yesterday. But yesterday may not be realistic for us, and particularly manpower and getting other things to work on is not realistic if you say that we will do it right away. So we need to be clear on that and objectively appraise what we have and what we can do and at what time frame. The technique of negotiation, again, there are a variety of skills, and again, it's important to know the different styles and then pick what might be working best for you and for the situation. Now, a couple of approaches that I wanted to mention about as far as negotiation. One is what we call distributive bargaining, in which we assume that there cannot be any solution that could result in a win-win situation. This is what we call as distributive bargaining, where we say that we are operating under what we call a zero-sum condition, where if one party gains, automatically the other party has to lose an equal amount so that the total sum is zero. And that's what we think about when we talk about distributive bargaining, or what we call a zero-sum condition. But what happens here is each party that's involved in the negotiation has a certain level of a target point which they are willing to come, but they also have what we call a resistance point, where at that stage they say that that's the lowest acceptable outcome that they are willing to accept. And at that stage, if things don't work out, what we call is it's a break off in the negotiation. And this is what we call distributive bargaining in our approach to negotiation. The other one is what we focus as integrative bargaining, where we get into the entire negotiation process understanding that there can be more than one solution to this, and there is a possibility of a win-win situation, maybe with a little bit of give and take, where you eliminate difference but you're focusing predominantly on cooperation and long-term relationship. Don't want to get into a lot of these details, but just different approaches where you could be a sales negotiator, where you're setting the stage, identifying the interests, clarify what are the negotiable issues and values, and then present the options and finally agree on win-win situation. Or you could be a customer negotiator, where you're just open, you're focused, you have the knowledge evaluation, but you're going to put everything together and then come back on a decision. A lot of our negotiation strategies can be clearly categorized based on our level of cooperativeness and our level of assertiveness. And I don't think this works, but basically if you're not cooperative and you're not assertive, basically you're going to avoid the negotiation. That's what's going to happen, as you can see in the left bottom corner. If you're cooperative but you're not assertive, then you're going to end up as an accommodating negotiator. If you are not cooperative but very assertive, then you are only going to compete and it may not work out sometimes. Okay. But if you're cooperative and also assertive, then you become what we call a collaborating negotiator. And if you're somewhere in between, compromising negotiator, and most of us probably are somewhere in the middle. Again, different styles could be profiled depending on observations in the negotiation process. Certainly there are cultural differences. The French people are thought to be very indifferent to what other people or the opponents think of them, and these are all valid studies. It's not my approach to negotiation. So they feel that they don't care about what the other person thinks, and it can result in very prolonged negotiation process. The Chinese and Japanese believe clearly in building long-term relationships. They work out a lot of minute details. They make sure that they they get a commitment from each other. Americans are thought to be very impatient and try to end negotiations as quickly as we can. Arabs follow very subjective feelings and emotions so that they can get what they want, achieve their end. Russians follow a lot of the time examples to support their arguments. And how do we negotiate like an Indian? We are the pros in negotiating, because the true price of any item, according to us, is what you pay. And what we try to do is to try to take 70% off. It's never 30% off. So never accept anything less than 30%. And when you're bargaining with the merchants, make sure that they show us a lot of things before we come to any decision. And we do that with administrators as well. Make sure that they show a lot of merchandise, a lot of things that are offered. But you make your offer only one at a time. You look at a lot of things, but you make sure that you offer only one at a time. A lot of the time we wait for the pad and paper finally showing us something, and then even at that time keep saying it's too high. That's our approach to negotiation, where we say it's too high a lot of times. And after all that negotiation of one thing, we'll say, what if I take two? So we'll go for a bundled approach, and at that time probably can achieve a lot more. And again, these are all studied things. I mean, yes, when we introspect ourselves, we probably understand that, yes, we have been doing this subconsciously several times, but this is what we end up doing. So how do we talk money with the administrators? Number one is we have to identify of any problem or an opportunity, and this is something that we do day to day. I mean, do you want to get additional beds in the ICU? Do you want to get a new ultrasound machine? Do you want to get a new HFO? It doesn't matter. I mean, it could be any of those things where you have to identify what is the potential or what is the problem. The second thing is you have to walk to them with a proposed solution. There's no way you can go and just tell them the problem, because they're going to look at you and say, so what do you think? And that's where we need to be prepared. Identify who are the key decision makers and influencers in the organization. And again, sometimes it may be your director of medical service, sometimes it could be a CEO who is a non-medical person. So we have to go to the right things for the right people. I mean, if I need my sink or bathroom changed, there's no point in talking to the director of medical service, because that's not what he or she might focus on. So identifying, make sure who can influence, who can get it done is going to be one of the key factors. Define your metrics or measures, make sure you are clear when you're presenting. And again, also identify what are going to be your actions and ensure that you're aligning the key players. And I think this is important, where you should have spoken with others who are going to be aligned to you and assist you in this process of negotiation, utilizing what we call the Plan, Do, Check, Act, or the PDCA model on anything. Nothing is complete. It's always a cycle. You plan something, you develop, but you keep checking it, act, and once again, once it's done, it's not complete. You have to audit yourself and ensure that you plan for growth or plan further. And putting it all together in a format that meets the information, whatever be the audience, whether it is your administrators or your other medical staff. Again, not to go into the details, when we negotiate, we need to build a relationship, you need to understand what the interest is, try and look at what are the alternatives, and this is where communicating with everybody, looking at what the alternatives are, being open to that is important, and you need to be legitimate to with the validation of the process. But more importantly, you need to know what is your BATNA. We call it the best alternative to negotiated agreement. So what it is if this doesn't happen, what are you going to do? And that's something you need to be prepared before you actually go to the administrators. Because sometimes your best alternative may be that you may have to quit the job, and are you prepared for that? And that's something that you have to be prepared before you get in, rather than during the process of negotiation. I just thought I'll take this quick example. I know I have only a couple of minutes, but something like an intensivist-led team, and this is not something that all of our hospitals have. I think most of our ICUs are still, open ICUs. So we are assuming that there are benefits on published data, that intensivist-led team is going to make a difference, but we need to present it to the right people and get buy-in from our other medical staff even before we talk to the administrators. Kind of model in on what are the top 5 diagnoses. I mean, is it respiratory, cardiac, post-operative, neurological, some others? I mean, there might be some units where it's predominantly gastroenterology, liver transplant, whatever, and focus and say what kind of value you can add to those groups of patients. But it's also important for us to get a reasonable idea on the cash outflows. What's it going to cost to maintain the team? What's going to be the cost of care? What kind of cash inflows would come in? What are the savings you can have? What are the reimbursements you can have? And sometimes these are tricky. And it's important to tell the administrators that revenue from critical care is not just direct revenues. There are so many indirect revenues that we are creating for the hospital by ordering the appropriate lab investigations, radiology investigations and stuff. It's important for us to focus on the value of revenue generation, but also the outcomes that are being influenced in the critical care. So to summarize, the 6 steps that we have in the negotiation process are: number 1, agree to negotiate, have a plan, have a problem or an issue, ensure that you gather your points of view, focus on what the interests are, but try to create win-win options. Think of what are the other options, think of what your BATNA is, best alternative to negotiated agreement, and then come to an agreement. And as my topic says, what should we do and not do? Number 1, don't appear needy, because I think the administrators can clearly smell desperation. If they know that you are not going to walk out without this, then they're going to push you. Don't take it personally. I mean, a lot of the times, there may be emotions that happen, but it is not personal. You are looking at what negotiation should be. Be prepared to walk away. I mean, you have to be able to say no, and that actually strengthens your position and respect. Don't force it, because a lot of it is just give and take. Do your research, anticipate the objections that they are likely to have. Practice, practice, practice. Make sure that you put this together. Talk to yourself in a mirror, or to your wife or spouse, I should say. Ask for it. And if you feel that something should be done, and if you feel it is deserved, don't feel embarrassed. Go ahead and ask for it.